Welcome to Sports Doc Talk. This is our 15-minute edition. I'm keeping my fingers crossed that we're going to hit that 15-minute or less.
We're not going to.
We can do it. I'm Will Sanchez, along with orthopedics surgeon and sports medicine specialist, Dr. Grant Garcia, our top doctor. You know him. We love him. He's got this cool, funky background going on, man. It's very like, wow, look at that. It's a Stanley Kubrick kind of thing going on, man. How are you?
I'm good. This is a nice fun. You texted me this weekend. You said this. You talked about this Mike Trout injury, and I was like, you know what? It's time. This is our first video 15-minute segment, too. All the other ones have been audio. This is the first blast, and we're hoping for this season to do a few more of these because I think that our listeners like these a lot. Like, because it's more cutting edge, it's more recent, and this meniscus stuff we're going to talk about is just keeps coming up. It's just nonstop with these. We just talked about it in the Olympic episode literally last week.
Yeah. And listen, when you have an injury to a first ballot Hall of Famer, Mike Trout, someone that his career path was up there with some of the greatest players ever, except for the last 5 years now, where he's been pretty much robbed of a complete baseball season, and we'll show you the stats later on, due to injuries. So just to recap, on April 29th, Mike Trout was playing in a game, felt a little something in his knee, ran the bases, played the outfield, came in, was like, yeah, I think I'm good. No concerns. He goes home, and I want you to kind of chime in on this. He goes home, goes to bed, and is like, oh, something is not feeling right. He's having pain. He's going through pain at night, wakes up in the morning, calls the doctor, is like, hey, I'm having some issues with my knee. Maybe we should just go check it out just in case. He wasn't thinking of anything because of the way that he was able to complete the game. Finds out on April 29th that he tore his meniscus. Before we go further, what happened to Mike Trout? Is it just the adrenaline that kind of kept him going through, or things didn't settle in? What happened when he got home at night, laid down, and when he was trying to sleep, all of a sudden this pain started coming on?
So one, obviously you don't know the tear pattern. We didn't see the MRI. We talked about there's various tear patterns, right? You got these meniscus, it's C-shaped.
Yeah.
You can have a radial tear. That's a big split. Probably not that. Usually that's a massive pop, and then you're like literally unable to walk, which is what we thought was happened to the Olympian, right? Big crack.
Yeah.
This is a different thing. But again, we don't want to give away too much of it, but obviously it was repairable. So it was some tear pattern maybe in the back of the meniscus where there's better blood supply. When you get a tear right there, and usually it's a tear, he's probably from when he was batting or rounding the bases, right? Like it's a plant shift. And one thing that can increase the risk of this is probably the cleats when he's batting, right? Because you plant the foot and then you're cranking the knee. And if there's any they can have, guys like this that are playing all the time, they can have these little small meniscus tears. We used to see it. We took care of the Giants and the Mets and stuff. We'd have Monday morning kind of MRI review, and you get to see some crazy stuff in MRIs for players that are still actively playing.
Yeah.
Right. So he may have had some small capsular tear that you couldn't really recognize. Twisted, had some pain, and maybe had a little tweak, and he's like, hey, I'm fine, I'm gonna deal with it.
Yeah.
Then he gets home, and what happens is these tend to ache. And like my patients who have these special capsular tears or tears in the back where there's blood supply, they say at night they have to put pillows between their legs, and anytime they twist or move, it hurts a lot more.
Yeah.
And it probably started swelling up on it. So like that's what he probably felt. And that's only me reading between the lines from experience, from him getting a fixable repair, and just from the fact that it acted more at night. And these tear patterns that he got, these tend to be ones that people can kind of go up and down with, right? Like sometimes they know, but he's Mike Trout, so he's getting MRI right away. Like some of these patients that come in, they're like, they've had it for 2 months. They don't even they know, they're just kind of like dealing with it.
Yeah, so he has surgery on May 3rd, right? So we go back to April 29th. This is when he felt that whatever happened to his knee, obviously we know that was a torn meniscus, goes in May 3rd, begins rehab assignment at AAA Salt Lake on July 24th. Before that, on the Thursday, they said that the MRI was clean and it was expected to start running shortly. And then he goes rehab assignment, plays 2 innings, leaves the game due to knee discomfort, right? And then they necessitated a follow-up MRI, which revealed a new tear separate from the first one. And they're saying it's unclear that how he tore his second or how he suffered a second tear. So I'm not
This
sure
is
going full conspiracy theory or what, but what is your what when you hear these things, what could have happened? Because obviously this man is the franchise and the face of baseball, one of the faces of baseball, the franchise for the Angels. They wouldn't, I would assume that they're not going to risk his health based on them rushing him. So what happened? What do you think happened? The fact that he has an MRI, he has a meniscus tear, and now suffers another one a month and a half later after surgery?
Yeah. So again, obviously, we don't hold me to this, right? Or hold me to it. But you know how this works. We're predicting a
Wait, hold
surgical
on. I'm
amputation.
writing down notes to hold you to it. Hold on a
Write
second.
it down. Write it
Okay,
down.
go
Maybe
ahead.
you'll find out in like 6 months. I had no idea what I was talking about, but that's
Okay.
okay. That's how we do the show. So and again, thankfully my ego's not too soft, so I think I can handle it. So anyhow,
That's right.
so basically he gets a fix. So you already know that the tear is a special type of tear, right? There's only certain tears we can fix. Some of these baseball players, football players, they get tears that are kind of just trash meniscus, and you can't fix those, right? Probably not a root tear, probably not one of the more complex radial tears we talked about. He would have been out for a lot longer, 5, 6 months. So I'm reading between the lines, right? He had a tear of the meniscus, and you guys see here medial or lateral. Generally, they're medial, but I don't know which side his was. Medial means it's on the inside of the knee. You can see there, and then there's usually it's around the capsule. So the meniscus has blood supply in 3 zones.
Mhm.
White, which means there's no blood supply. Those almost always get removed. Middle, which is red-white. Occasionally we fix those, and we're starting to push the envelope on fixing those, which we've talked about on previous episodes. And younger patients, we fix them more.
Yeah.
And then red, which is right next to the blood supply. Those you want to fix as much as possible, because if you don't fix it, you remove a lot of meniscus. And we've seen already, we've talked about this a number of times on this show, that removing that much meniscus is not good for people. If you have to do it, people ask like in their 50s, like, you're removing my meniscus. Why are you doing that? Well, I can't fix it then, right? It doesn't heal the same as it does in someone like Mike Trout, who's still young, active and healthy. And really the meniscus under, 40, 30 years old, you just want to fix as
Yeah,
many as you can.
he's 32 years old, just to kind of give you the age group. He
Got it.
turns
So 32 years
33.
old.
In fact, it is, I think it's almost his birthday, August 7th,
Well,
33 years old.
unfortunately, happy birthday to him. So anyhow, so basically he gets this fixed, and it's probably a capsular tear. He probably gets it fixed. There's different ways of doing this, right? There's stitches. You can do stitches from just 2 little poke holes. He can have a bunch of stitches in his knee, and someone catches him out the back, and you tie him in the back, and that's kind of like the more aggressive, kind of gold standard method. So what happens is he gets that done, and he gets his 3-month recovery. That's what makes me assume it was probably one of those, right? Because it's only 3 months.
Yeah.
He starts running on it. He gets a clean MRI. The problem you have with the MRIs on these meniscus is you can't. I've been on my own meniscus, and sometimes you think the MRIs are clean, or you go in there for another reason, right? You rescope their knee because they're having some other issue, or like a year or 2 later, something else gets hurt, right? And you rescope them, and then you go in there and you see like your meniscus repair is like mostly healed. There's still the stitches in there, but there's a line like where like imagine like your meniscus tear is like a full slit, right? It's the whole thickness of my fingers, only like this much healed, right? So you still have a layer that's a tear on the top, but
Yeah.
on the MRI it looks like it's a full connected tear repair, because what
Okay.
happens is scar tissue is really hard to pick up on these MRIs sometimes. So they always say, like, some of the reports, like I look at the MRIs myself, but the reports say possible tear but maybe due to surgery, so it may just be healing, because people always want to know, did it heal? So they think it healed. They let him go back out, and he re-tears it, or he ripped through the stitches, and that's what I think happened. The stitches we
Uh,
place,
yep.
you place it, they're stress risers, and if it doesn't heal, those stitches are now holes in the meniscus, and they can tug on them. And to be honest with you, I've had this happen to me. I do a lot of meniscus repairs, and every once in a while you get in, and the meniscus didn't heal, and now you've got this sort of rope in the meniscus, and if it doesn't heal and just scar in, it can act as like a knife, and it can cut through. It's not anybody's fault. It's just the fact it didn't heal, and now he created a new tear.
So
And that's why it was a separate area.
I want to read a quote from him, right? Because to me, this is a warning sign or a concerning sign. And for you, it's probably nothing because you're like, yeah, I hear this all the time. He says, since my initial surgery on May 3rd to repair my meniscus, my rehabilitation proved longer and more difficult than anticipated. But if you talk about the 3-month timeline, he came back right before the 3-month timeline. So if you're saying that it was a difficult process, and maybe it's just because these guys are superhuman, so the fact that you don't recover as fast as you expect, that all of a sudden is a warning sign for the player. But when he says something like that, are you concerned, or is this something that it was just maybe bad luck for, either didn't heal properly or he popped that stitch and he suffered that tear?
This is a classic sign that, again, first off, don't know the situation, but and he's also, he's frustrated. You'll show a stat how many times he's been injured, right?
Yeah.
So to him, it's like any day he's down, he's like, this is so long, right? Like I'll see 4 patients with the same ACL surgery done within a few weeks of each other, same surgeon, same technique. And one will be like, oh, this process was terrible. It was so long. I'm like stressed. I don't want to do it again.
Yeah.
Second one's like, thank you so much. You saved my knee. All of them look the same, but they all have different complaints, right? So you
Yeah.
don't know. But the ones when I get these revision situations where something happens, or I see someone that's had this, and let's say they go to get a second opinion, right? And they're like, my knee never felt right after the surgery. That's the ones you're kind of like, okay, that's a little bit fishy. I don't think it's fishy with the Angels. I think they probably did everything they're supposed to do. And also, it's really easy for, I don't know when he quoted this, but it's really easy for Mike Trout to say my recovery wasn't as good as I wanted when he retore his
Oh,
meniscus.
after the fact. Yeah. If it's after the
Yeah,
fact.
like it's
Yeah.
just total bias. So,
Yeah.
you don't know. But, and also, like, we know patients, and Mike Trout's no different. I mean, this guy's smart, but he's not a rocket scientist. Like, I'm sure the surgeon told him how long it was going to be, and he just was like, "Whatever you want to do, doc, just fix me."
Yeah. Yeah.
Right? And sometimes they don't listen, and they're sitting there like at 2 months, and they're like, "Why is my knee still swollen?" I'm like, "I told you it's going to take a long time."
So when it comes to the recovery process, right? Tear, now re-tear, 14 seasons in the Major League Baseball. He's going into his 15th season. Just turning 33 years old. So not old as far as age, and even baseball, you kind of should be in your prime, but he really started his career at an early age, which was really fast tracking him to this Hall of Fame resume. Uh, what's the recovery process, and then what are some of the concerns now? Obviously, he's out for the whole season, so he'll have the rest of this year going into the winter and then coming back for spring. Are there any concerns at this point for as a doctor there, or is it something like, hey, it's just shit happens? We go through the recovery process. Go through your PT, start over, get stronger, and we should see him back on the field. Or is it something where you go, all right, now we've got into that knee. What have we lost, right? You're not looking at the knee. What has been lost already from these surgeries to maybe impact not only his recovery process, but possibly continuing his career because he hasn't played a full season in quite some time?
Yeah, and you can show the stats there. So basically, so to answer your question, this is really concerning. I mean, usually I tell them if someone good did his surgery, which I think it was,
Yeah.
um, the odds of it being fixable again are pretty low. And going in and trying it again on a guy like this might be a bad idea, right? Because you're going to look pretty bad if he fails again in like 3 months,
Mm.
right? We know about it was one of the guys. It was a guy that retore his triceps tendon for the Giants, and then he tore it again after playing. It was out again for another 6 months, right? Like, it just doesn't. This is unfortunately get a little bit scary. I don't want to say this word, but it's just sounding like Lonzo Ball, right? Like meniscus, remeniscus. Now again, the first was a repair, but the second was likely a removal, and we know where that went. And so that's obviously worst case scenario. But I don't think the amount of time that he has to recover really matters, to be honest with you.
Yeah.
It's what the health of the cartilage is and how much meniscus gets removed. If his cartilage is healthy, which we don't know, probably is, maybe, hopefully, because he's still young, then he's going to be in a better situation. And if it's a medial meniscus, which what we showed on the board, medial meniscus, they do way better. If it's a lateral meniscus removed, they do a lot worse. And I mean, I took care of an NFL guy that retired at 32. This guy was incredibly athletic, had 2 lateral meniscus removals, came to my office with a knee that was like knock-kneed like this, terrible arthritis at 32, right? So
Yeah.
that's what happens on the lateral side. Medials tend to last a lot longer. So if he gets his medial meniscus removed at this point, he may make it, he'll probably make it for the next few years of his rest of his career. And then obviously eventually may have issues in the long run. But again, a lot of these athletes have that. It's not from this actual injury per se. But again, the problem is if he has not, all of a sudden he loses his meniscus and he starts getting a cartilage hole, then we're looking at the same issue. Is he going to get a microfracture, which we've mentioned before? Is he going to get a cartilage procedure? Is that even going to be possible for him? I hope not. We got to see the worst case scenario with Lonzo Ball needing a really big surgery, like a Hail Mary surgery for a professional athlete.
Yeah.
But those are the risks. If they do a repair, I'd be shocked. And then recovery wise, generally it depends on the type of tear you repair, but usually, 2 weeks of crutches, 1 week no weight, 1 week partial, brace for 6 weeks with that sort of 3 to 4 month recovery. But everyone's different, right? Like Mike Trout's getting the best PT.
Yeah.
Some patients takes 5-6 months. So it just depends on the level of what he's having. If he just gets the cleanup or, that usual clean, people go say they clean the knee, right? Did the little cleanup of the knee, that's probably 6-8 weeks. So he doesn't need all that time to get back. So we'll know how he's doing probably in the off season or towards the playoffs or pre. But also depends. Like if he's out for the season, right? Because you have August, September, October, they're out.
Yeah, no,
so you'll
he's
see
done
how
for the
he's
year.
running.
Yeah, no, he's done for the year, and obviously it's a smart move. Let's wrap it up here because we've gone over our 15 minutes, so we got to change our 15-minute segment to 17:23. But I have to ask it: any advancements right now when it comes to meniscus? Recovery or surgery, things like that. We always like to talk about, future stuff and all the cool toys that are out there. Is there anything that you can kind of throw out there that might be beneficial or depending on really kind of what's going on? And just to clarify with everyone that's listening or watching, it's hard we're talking about the injury itself. It's hard to know exactly what it is unless Dr. Garcia was in there looking at the knee. So I just want to kind of throw that out there as well.
Well, and also for layman terms, right? Like everyone hears the word meniscus tear, they all seem they're the same. For me, as a meniscus specialist, if I go in like tomorrow, I'm doing 3 different types of meniscus repairs, right? They're all 3 different.
Yeah.
So it's a very large gamut of that, and I'm getting into the minutia of it. But so advancements. So this is very similar to the ACL biologics. So the one advancement is we did a microfracture I told you about originally on the show, poke holes where there's the ACL, PCL, and the stem cells. So I'm assuming the surgeon did that. There's been some studies on PRP. So we take PRP, inject in the knee after the meniscus repair, hopefully help it. One other slick thing you can do is you can take blood, turn it into a fibrin clot, and try to sneak that into the meniscus repair that you're doing. Again, this is assuming that he's getting a meniscus repair. So you want to get that. Also, what matters is kind of crazy, but you just have to do a good job on repairing it, right? Like you can't skimp. So this is getting the details, but if you fix them, so the meniscus fibers are radial, so they're circular. Does that make sense?
Yep.
Circular. So if you fix it horizontally, so I'm trying to do my best here to show you. If you fix it horizontally, you can go right through the meniscus. You see that? If you fix it vertically, you cinch the meniscus and it won't tear out when you fix it. So when you do your repair, you want to try to get your repair sutures like this rather than like this. I mean, you have to sometimes do that, but like this way is stronger in the meniscus.
So sutures
all those
vertical, not horizontal, right? Because
vertical. See, remember, think about this. I'm coming at you like this. Scissors. Vertical. You don't want there you go. Anyhow, so that's gonna scare everybody now. Anyhow, and then there's Bowmer aspirates. I'm sure he's getting everything. I'm sure he's doing that. I'm sure he's getting more stuff. And there's like collagen gels they're talking about. Again, this is when you figure out the solution on how you can take an 80% success surgery, without an ACL tear, this is there are people that do not do as well. If he tore his ACL at the same time, the success rate would go way up, right? So it's the issue is without the ACL is the problem here. And so we're looking at everything. Like I said, PRP, fibrin clot. I mean, I'm working on some of this stuff right now with other things and how we can make our ACL repairs better. So the biologics is a huge topic on this. We're just not there yet, but we're going to be there hopefully soon in the next few years. So we'll see.
Great job, Dr. Garcia. We hope that the 3-time AL MVP gets back on the field next season and is able to perform for all the fans out there that enjoy watching them. Because as you know, careers come and go pretty quickly. Dr. Garcia, say bye to the fans.
Peace out, guys. Remember, vertical.
Vertical, not horizontal, and don't have Edward Scissorhand nightmares. Peace.